All right, good morning, folks. It's Jeremy with the Hospital PT. The family and I are going to be preparing to go to Broken Bow, Oklahoma today. And before we kind of started getting everything together, I wanted to hop on and share a patient story with you guys that further highlights some of the issues that I've expressed and covered over the last several videos on my channel. So this lady, the patient that I was assessing, she was an 80-year-old lady. She came in because she had fallen at home and she hit her head and had a brain bleed. Okay. Now, thankfully, I'll spare you all the particulars, but thankfully she did not need any surgery for it, and she was doing pretty well when I went to assess her in the medical ICU. The only little thing she had going on was her blood pressure was being kind of stubbornly high. So we had to, she had to have that dealt with. But all in all, she had maintained her strength. She didn't have any, significant weakness at the time of my assessment. So what was more interesting, though, was the context in which she fell. So she was living at home independently. She did not need any type of assistive device. Her daughter was present in the room and verified that she runs after grandchildren and goes and does errands in town and drives and is active in the garden and those types of things. So fairly healthy lady at 80 years old, especially. Her daughter also indicated to me, she said, ask her how she fell. And so I said, Miss So-and-so, how'd you fall? And she said, well, my husband had open heart surgery 6 weeks ago. He was recovering pretty well. They discharged him home, and he had been explaining to me, or expressing to me, that he had been experiencing some episodes of weakness and that he felt like his legs were going to give out several times over the last month or so. And this was after he discharged back from, home from the hospital. Well, one day she was kind of walking along with him, helping him do some of his cardiac rehab, if you will. Most cardiac rehab patients get a walking program after they have open heart surgery or something like that. They get a walking program that they complete day to day at home. And I'm sure that she was helping him do that. And because he had expressed the episodes of weakness, she felt compelled to walk next to him, just in case something happened. Well, something did happen, and he fell. And she tried to help him prevent him. She tried to help prevent him from falling. And when she did, he knocked her over. And they both fell, and she hit her head and had to come to the hospital. And so, thankfully, it seemed, all indications were pointing to the fact that she was going to recover well. But this story also highlights the fact that when you have a loved one that has been infirmed, for any particular reason, open heart surgery or otherwise, and they're trying to mobilize at home and get back to some sort of normal, and you're trying to, and if you're a spouse or a caregiver or a loved one of that person, and they begin to express some issues that are affecting their mobility, you need to take them seriously, because issues like this can happen very, very quickly. This gentleman is probably a normal sized individual, and this lady was a healthy, active lady, but she can help him safely enough to control the fall without also falling herself. Okay. Now, we see this often with family members. They say, I didn't realize they were going to require that much assistance to walk, or I didn't realize that it would be that difficult to help them if they were going to fall. And when someone starts to fall, it doesn't happen in slow motion. It's a very quick process, and if you're not prepared for it, then things can get very tricky or very hairy, if you will. And so, if you have a loved one that has had it, has been in the hospital, or this may be a particularly salient story for children of elder parents. Okay, especially, if some of our elder generation, they are fiercely independent people. Okay, I have grandparents that are like this. They do not want anyone to help them. They will help someone, but they do not want to need help for the most part. And that while that's certainly honorable in some ways, it oftentimes creates risky situations and dangerous situations. And so as children of aging parents, we all must be vigilant in assessing not only, let's say in this particular situation, the husband was infirmed first, had open heart surgery, and seemed to be recovering well until something was going on. So they probably weren't aware, the children probably weren't aware that this was happening until it caused this particular issue where, mom was trying to help him, he fell, and now she needs to go to the hospital too. And so it's worth thinking through. And I know that this is what we do as therapists in the hospitals, that yes, most of the time, 90% of our effort and perspective is spent on thinking about what is best for the patient in the bed. Okay, but if there is a caregiver or a loved one there, we also spend time helping them think through what things may look like at home for them, and we have to think about their safety as well, not just the safety of the patient, though that is our primary concern. So, and this is something to be aware of as a parent of an aging, or as a child of an aging parent, is that you have to think, okay, what if something does go wrong with mom or dad? What's going to happen with the other spouse? Are they capable of helping the patient or the other spouse? Are they, do they have the necessary mobility themselves? And so just wanted to share that story with you guys because the daughter in the room said, wow, I didn't have any appreciation for the risk there was to my mom if something was to go wrong with my dad in his recovery. And basically what I told her, I said, that's because you're worried about the it's not I tried to encourage her not to beat herself up too much, because when someone's in the hospital and they have open heart surgery, that's a very significant experience, okay? And everybody's focused on trying to help the patient get home for the most part, okay? And you're not really concerned about the other spouse necessarily, because she was doing well, and she had, up until her trying to help him stop from falling, she was doing well too. It was just that the context in which she fell, she got knocked over by trying to help him. So just keep this story in mind. If you have friends or family, or if you yourself have been in a similar situation, falling is very common amongst our, over the age of 65, and it can happen for all sorts of reasons, and we've covered some of those in the past videos. Okay, so if you have a loved one that is, or if you have an aging parent that was in the hospital and they plan to go back home with their spouse, keep this story in mind and really spend some time making sure that they're both equipped to be at home. Ask the therapy team in the hospital how they feel about it. Ask the physicians, are there any risks for medication complications that would cause them to be more likely to fall or get dizzy or anything like that. And in my next video, I'm gonna go over more specifically some things that I wish families knew before leaving the hospital. Okay, and they're going to be very similar to some of the things that I've said so far, but maybe just put it in a more concise package for you guys to think through and be able to reference if you find yourself in a situation like this. So until next time, remember, and I'm going to cover the meaning behind this statement at some point on this channel, and that is, remember, you can't go wrong getting strong. Okay, you can't go wrong getting strong. So I'll see you on the next video. Until then, have a good one.